Today on True Patriot Love, under the pillar military healthcare, we're going to have Brian Isted. And Brian's going to tell us a shameful story. We send our military members abroad. We send them into harm's way. They get hurt, they get injured. And when they come back, we put them right into our terrible healthcare system. We know our healthcare system's broken. We've talked about it on many shows. We know the mess. We don't even give our military personnel priority. We bring them back. We found out we don't have military hospitals or facilities for these individuals. We don't have specialists for them. They don't have priority. And when they go to get trained up, they have to enter the same educational system to become doctors and nurses as the rest of our civilians. What is going on? How do we not identify this as a critical factor? If we're going to build a military and we're going to make it a force, we need to make things like healthcare, housing, recruitment a priority. Today on True Patriot Love Media, under the pillar healthcare, I'm happy to welcome back Brian to talk about also military. So welcome back, Brian.
Thank you. Thank you for having me.
So, when getting ready for the show, because I talked to Brian, we did a great show a few weeks ago on housing and recruitment in the military. So I said, Jim, we got to get together, do another show. And I was getting ready for the show, and the show's basically on healthcare in the military. Getting ready for the show, and a story broke. And there's a number of stories on healthcare across Canada right now. A story originally broke a few weeks ago on Quebec. And we did an awesome show where we went through the dispute between doctors and the government. And we looked at the government's point of view on healthcare, and we found out it was fairly reasonable. And the doctors were complaining that they had to go to a performance schedule. So we took a look at it. We came back and said, no, there's some things they could tweak in the formula they were giving the doctors. But I think it was, all in all, I think they had a fairly reasonable concept. 2 million Quebecers didn't have health care, didn't have a doctor. We could see where people were struggling. And we said that, the government had done a good job at creating group services to create health care for everyone. And when we did the math, we found out that there were roughly one doctor for every 369 people in Quebec. And the doctors were complaining they were overworked. So the math didn't work. So we left that podcast, and we were all sitting around, and we started thinking to ourselves, we need to do another show because the math in the show didn't work. So when we calculated all the calculations, we went through the numbers that the doctors and the Quebec government were throwing. We're like, there's got to be something weird here. There's got to be some fraud. There's got to be some collusion, some craziness going on. So just as we're doing this, getting ready for another show, the Ontario's OHIP story breaks out. And I was telling Brian before the show. So they found out that they had 59 doctors who were billing 24 hours a day for over 90 days in a year. They had one doctor who was billing 114 hours in one day. So, and they had one ophthalmologist who billed 6.7 million in 2023 and 24. $6.7 million. So, and it was double the next highest billing for the next ophthalmologist was 50% lower. So anyways, these are just stories. And then basically we had to write off 1.4 billion in PPE that we had bought that's stale dated now. So we had to get rid of $1 billion in PPE supplies. So those are some of the things the Auditor General found. So then I said before the show, I said, I got to ask Brian, what is the healthcare like in the military? And so we started digging into it. We're doing some research, and I'm like, and I'm glad we're having him on today because I had no idea of any of this. I am totally ignorant, and I can't believe this because I have lived in the U.S., I've lived in Canada, I'm from Canada, And I thought for sure I would find medical schools and medical doctors, and I would find military hospitals. I'd find treatment for, all kinds of ailments, physical and mental, inside the military. I couldn't find them, Brian. And what am I missing?
Well, you can't find them because they don't exist. There are no military hospitals in Canada. There are no veteran hospitals in Canada. We are subject to. So if you have a minor injury, you get a scrape, you get a cut, maybe even a fracture, minor fracture, you'll go to the base hospital, the MIR it's called. I can't remember what that stands for, but it's sort of the base triage facility that can sort of give you baseline medical care. But if you have any real injury that requires sort of immediate surgical intervention, kind of equivalent of maybe a Rule 3, it would be called in military terms, like I've seen operationally overseas, you're taken off the base and you're taken to the nearest civilian hospital, because that's the only place that has the infrastructure, the specialist surgeons, orthopedists, or whoever you need to see to identify and properly treat that injury. So, for example, in Ottawa, where I was posted for 6 or 7 years, they have a hospital that's for military personnel, but it's attached to the civilian hospital. So that it's not a dedicated military building, but it has a military access point with controlled access through your key card that will allow you to get in to see the military doctors, some of whom are civilians who work for DND, and some of our trained military soldiers. One of the physicians I saw was previously a pilot in a previous life kind of career, prior training, and then moved over into the medical space and has since become a GP that I was seeing, and having many, many conversations with them, the nurses, the admin folks that were brave enough or honest enough to speak candidly with me about a lot of the things that I was dealing with, other people were dealing with. There's a tremendous amount of overworking and overburden that these people are stretched very thin, and the level of service is declining exponentially because of this. Like it's attriting people out because there's not enough people to keep up with the workload that they're given, and they're seeing so many patients all day, every day, that they just are, I think, kind of starting to throw their hands up and saying, like, this is too much. We can't really do this. And most of the people that I interacted with in the medical community professionally while I was at DND were well-meaning, well-intentioned people that were sort of handcuffed by the bureaucracy of policies or mandates or whatever. But there's just not enough to go around. And it's and again, like an awesome conversation we had a week or so ago, and then immediately following articles echoing exactly what we were talking about. There's not enough. People are leaving the military because they can't get access to care fast enough. If you want to get a CT scan, an MRI, like you're pushed immediately into the civilian system where you're waiting months and months. I've been waiting 2 years to see a spine specialist in Ontario. So fingers crossed, you know what I mean? Any day now, I'm going to be able to take one on. And when the referrals go out, everyone comes back and says, I can't take another patient. I don't have expertise in this area, et cetera, et cetera. So everyone is spread so thin, and there's no money to go around, and no infrastructure even to put them in the first place. So it's just this hemorrhaging inferno of issues that someone needs to address pretty quickly.
Well, yeah, I get it, but it's interesting. We're talking about this massive allocation of funds in the 2025 budget to increase military, just like housing, like we talked about, but yet we don't have allocated healthcare. And I did, I don't know, it's more than a year, say it's almost a year and a half. I basically lived in Annapolis, Maryland for a year and a half, home of the Naval Academy. And so I was on and off the base all the time because there's tours, and I made friends down there. So, and it was amazing, the facilities at the academy, and also basically the medical services, the support services, all the things that the community provided there. And I thought, I didn't even really think twice about it. I thought for sure there would be, a facility, let's say, and maybe not for operating, but I did, I guess naively think that in Canada, we'd have one on the West Coast, one centrally, one on the East Coast, and one in Quebec. I just assumed, dumb me, but I basically assumed that we would basically buy a building, or take an old government building, create it, and provide healthcare for the people in the armed forces, and take care of them when they were on service, and when they finished up and they retired. But I couldn't believe I'm wrong. So here's the thing that kind of grabbed me. I started off the show just talking kind of, it's a mess. Like, the more we dig into healthcare as a subject, it's just a mess in every province, whether it's overbilling, whether it's poor performance, whether it's, no one showing up, whether it's not coordinated very well. It's a mess. So we're now thinking of increasing our military and using our health services outside of the military to service the increase in people. Like that, it just doesn't seem rational. And if I was thinking of a project right now, wouldn't it be to set up an internal health services network inside of the armed forces?
Yeah, that's so I just want to back up 15 seconds when you said it's not rational, and the problem that you're experiencing internally is that you're using ration and logic to determine the way ahead, and I don't think anybody in any position of authority is doing that.
Yeah.
It makes total sense. Like, let's bring in more people that I said that want to be here, that are there for the right reasons, that'll stick around, and then build the infrastructure to support those people, whether it's, the daycare facilities, the healthcare. A perfect example is the U.S. bases that you said you were living near or on. If you go to a U.S. base, and I spent a reasonable amount of time in the U.S. training among Marines and Army folks, and their bases are gigantic, absolute gigantic, with whole small cities built inside of them to accommodate. And the U.S. military has its own problems, and I'm not going to pretend like they have all the answers, but
No.
you can go into these fully equipped, fully functional, legit hospital infrastructure support to get your MRI, your screening, your this done, your that done. All that stuff can be done in-house, and we just don't have anything like that. Everything has to be farmed out. So you just go to the back of the line with everybody else, and you wait your turn, and it's really a source of stress and strain on the people that are already dealing with all the other issues that we addressed. And we don't have anywhere near the support or the investment of the Americans. And obviously we don't need it. They have 10x, 20x our amount of people, but there should be at least a plan in place to try to keep up with the demand that we have. And I just don't see it. Like, I just did a quick search on Grok right before this interview, and in the last 10 years, we've spent $19 billion on DEI and gender-based initiatives in just 10 years. So imagine how many hospitals and doctors we could have trained for $19 billion. And the vast majority of that money was sent outside of the country for sort of foreign relations, whatever you want to call that. Just like, who knows where that money went? I can guarantee it didn't end up in diversity training. Even if it did, that's still a waste of money. But yeah, we don't have anything in place to take care of our people. And it's yet another reason for the attrition that people are experiencing.
Well, and here's the crazy thing, Brian, you're talking about a personal situation, health-wise. 2 years, you should have priority. Like, past and present military personnel should have medical priority. That should just be the way it is, right? Number one, the people that are currently serving, we have to get them healthy and back in play. So that should be something that is prioritized. So that should be its own, if we're gonna commingle health services, we should have priority-based services and allocated services. That makes no sense not to have it. Someone's not thinking. Like, the fact that you have to drop off into our crazy pond of healthcare and try to navigate your way through, there should be someone that actually is coordinating that for you. And that I find that bizarre. I just think that's craziness. Hey, I wanted to talk about doctors, because this was an interesting one, and I didn't even know this. I thought, and this is, again, haven't spent any time on it, so I dug into it a little with the team. I thought, okay, they have their own dedicated doctors. Those doctors, go and they go to, military college. They get trained up. They get trained up in a specialty of field and triage, and they would be allocated. They would do, 5 to 7 years of service, and then they could go and leave, kind of like they do down at some of the academies in the States, where you have to stay for so many years after, and they'll pay for your medical. Then I found out, when we jumped into it, you apply to go to medical school, you go to medical school, you apply to the military, and you get subsidized. So, like, how hard is that? Like, what a hurdle. Think about that hurdle. And I know, because I have sons, and they've looked at it. Just getting into medical school now is a gargantuan task. Like, just, because it's so competitive, and the marks that people need to get, and the people that do it right now have to be super competitive. If you don't have money, so then, you're pretty much doing it because you want funding. I assume that's one of the main reasons that you do it, because, you need to pay your bills. So you join the military, you get it. We haven't developed a program that specifically is for military doctors. So we make them go through the process of being a doctor, and then hope that they'll divert to the military. And you brought up one reason I didn't think about, which I'm going to let you talk to, why they would join the military. But I was shocked. I was absolutely shocked that nurses and doctors aren't trained inside separately the military for their profession.
Nurses, I'm not 100% sure. I know that I think there is something for them. I can't speak to that. I'll look that up and get back to you. And I hope that people watching, if they're unsure, they go and find out, because I don't want to, give bad information. But in terms of the doctors, they're like, it's so competitive to get into these. If you're doing it as let's say you're an infantry officer, like how I joined in the reserve, but let's say you're 18 years old and you're going to go into college or university and you want to be an infantry officer, you can do what I think it's called ROTP, the regular officer training program or something like that. So you go to a civilian university and then you do your course training in the summer, but you graduate with and you get paid to go to school. So you graduate with employment obviously in your field, because you've got your degree, and now you immediately join, and you hopefully you sort of hit the ground running. You become a platoon commander, very likely, or something equivalent to that in your first years of training. But there's a lot of incentive, because you graduate with no debt, you get paid to go, and you're immediately employed in your field. So those are huge bonuses for a young person. Especially if I could relate it to myself when I came out of university and sort of now retroactively started going through the recruitment and application process that I told you about last time, and how much of a treat that was. So like, these incentives do exist, but for the doctors, they're so competitive, and there's so few positions that it's just, we're not able to supply the machine, it looks like, with what it actually needs, because we don't really have, again, the infrastructure or funding or professional training to support the amount of people that we actually need. And without any dedicated facilities to pushing through, these well-trained professionals, they have to go through the civilian system. And speaking with many of them, again, candidly, like I basically went to medical appointments almost full time for about 2 years, trying to figure out and diagnose all the problems that I've been experiencing post-vaccination, which is huge coincidence, right? I'm not going to say anything. I'm not going to dive into that just yet, but coincidentally, I started having just a cascade of health problems. And as I was talking to the physicians, like, they're just exhausted. These people are one after another, just going, one patient, next, and writing prescription for this. And I was put on a litany of everything anti-inflammatory, antidepressant. Like they were just prescribing me one thing after another to try to get me in and out as quick as possible. And when I actually got the time to sit down and discuss what was really going on and the questions that I had, most of them are sort of on the brink of sort of a nervous breakdown, it seems, and they're putting on this brave face to see their patients because they have to, and they don't have a choice. But I just think that we need more of these people, and a major reason that they stick around, given the fact that their working conditions and patient volume is so severe, is like the pensions. And they are a government employee now with a really good pension based on their, I don't know, 150, 200K plus salary that they're making as a doctor, a specialist in their field. And they're kind of handcuffed to it and really nowhere to go. So I understand where they're coming from in a lot of ways, but we just don't support them. We don't recruit them. We don't really pay them. And it's obvious, as we're seeing now, kind of with the brain drain that's always existed to the US or other countries. I think it's about to get more severe. And yeah, these problems are going to continue to cascade.
Yeah, but, and we let them. That's the frustrating thing, because, we go and we put a budget together. And again, as I said in many times during the budget analysis, I think we have to spend our way out of our problems right now with strategic programs and projects that have a return on investment to Canada. Military spending, I think, is great. I think it has to be creating new skill sets in the community. So this one, quite frankly, is, to me, is a no-brainer. So if I'm going to do healthcare in the military, I'm going to go and I'm going to find buildings that I can accommodate. Like I said, in the East Coast, West Coast, Central, Quebec, I'm going to find a building. I'm going to basically set it up, and then I'm going to start training healthcare professionals for the military as I'm expanding the number of people entering. So as I'm recruiting more. So as this crazy recruiting issue we talked about last time goes away, and we start to bring more people on board, which is what they're saying they want to do, then I'd have to create a healthcare. If I'm serious about this, I'd have to do it. Now, to me, now this becomes great, because now if I want more doctors, then quite frankly, I'd have to figure out how to co-partnership with one of the schools that does training for doctors, medical schools, universities, colleges for some healthcare providers. And then I'd have to figure out a way to set up a separate arm that they could actually go and get trained up. And I think that's terrific. And I think your point, Brian, and I want to go back to, because I think we have to focus on it in Canada more and more. No debt. Like, we don't need to put these kids into more schools to amass massive amount of debts to come out without employment. We don't, right? Like, we need to get focused with what we're doing with young people right now. And if it's going to the military, honestly, now you're telling me, I wish I would have thought about it when I was going to school, because quite frankly, I worked a full-time job. I hustled around to go to university. That's kind of how I graduated. It probably would have been better and more fun for me if I would actually, join the military, went to school, and then part-time, like you said, got paid to go to school so I could have enjoyed school, because I didn't enjoy school. I'll be truthful with it. I didn't. I went to U of T. I hated it. It was terrible. I worked 40 to 50 hours a week full-time. I studied when I could. I got accepted into the BCom program, which was great, and I graduated. But I think this would be terrific. I think it'd be great for doctors, because right now, expecting doctors to compete and then go to the military, I think it's almost you're asking for a tall order. So I think you should allocate so many positions to people who want to become doctors, who will commit to the military for, what do you think, Brian? 5 years, 10 years?
Yeah, I haven't done a deep dive into the sort of ones and zeros of what would make that work, but yeah, 5 years seems reasonable. My brother-in-law is a doctor, and he graduated with a couple $100,000 debt. from medical school, and it was such a burden on him, sort of psychologically, as now he's in his, by the time you finish your undergrad, you know what I mean, medical school, residency, all that stuff, like you're 30 plus years old by the time this stuff is all done, and now you're just starting to repay a $250,000 or whatever it is dollars debt. Like this thing should be subsidized across the board for both civilians and military physicians. But I agree with what you're saying 100%. We should be incentivizing in a huge way. Maybe give the folks who are willing to join the military a salary bump. You know what I mean? Let's give them some kind of discount on housing. Like you pay no tax on your house or whatever if you live within X distance from the base. Whatever. I haven't really, you know what I mean? Again, done a surgical examination of how to make this work, but these are relatively simple solutions that I think would solve complex problems if they could be applied at scale. And I think once again, you're just kind of hitting the nail on the head here and where we need to go. And the fact that we're not doing it and we're burning these people out at an exponential rate, not to mention I don't want to harp on this the whole time, but they burned a lot of bridges in the medical community with the COVID related policies and the COVID era stuff. I've spoken to personally, this must exist in an even bigger scale, but personally, I can speak to at least 3 case managers nurses that I've dealt with that told me that they either had horrific sort of side effects themselves, personally, physically, or one individual I spoke to that confided in me, and like names obviously don't matter, I'm not going to burn this person, but they went to get their second COVID shot in the line up and sit there in the tent and get your shot and then wait for 15 minutes. And in that 15-minute wait, the individual beside him fell over and had a seizure. You know what I mean? Like within minutes of having. So when my file reached his desk and he was saying, okay, well, I empathize with your situation and all the stuff you're going through because I've kind of seen how it goes and I'm not taking anything ever again that they give us because how do I trust anything now? Like this is coming from a medical professional in the medical field of the military. So if these people are asking questions and they have their doubts and they've seen the implications and the side effects firsthand, like that's not going to be, they're not going to be a great ambassador of the brand. You know what I mean? Moving forward to say, hey, have you thought of this? Or like, they're going to be saying, don't come here. You know what I mean? They're going to be, they're going to be waving people away saying, go to a good school, move to, you know what I mean, Texas, pay less tax and become a plastic surgeon or whatever. You know what I mean? These people are like by and large broken and overworked, and the COVID stuff, I think, put them over the edge.
Well, and I want to talk about that a little because, COVID to me is kind of symptomatic, right? So if you look at it, you can apply that to, being in the military, you're in a high risk job, right? You guys you ship out Iraq, you go wherever you're going, right? So you ship out, you're in a high risk environment, you go somewhere, number one, you don't know where you're going to land. You don't know what weapons are being used against you and what environment you're in and what bugs you're going to pick up, right? Because you're landing and you're moving in kind of hostile territory, not in great, like, you can tell us some stories, but you're for the most part, you're either securing a base or you're moving forward to do investigations of areas and reconnaissance. So you're kind of in a new place, new bugs, new agents. So the chances of you coming back with something are fairly high. Like if you think about it, like, and it doesn't have to be life altering, but it's just the fact that if anyone's traveled a lot, you go on vacation to some of these, whether it be a tropical island, whether it be South America, you're going to pick up new bugs and new strains of anything, right? So your guys are doing that all the time. So you come back and you decide you're done your service, you drop out, you find you have something. So you have to drop it back into the regular healthcare system. That makes no sense to me because that can't be. And some of the details I don't know, but do you guys get supplemented healthcare, like any compensation for that, Brian? Like, is there any, like when you retire or whether you leave, are your benefits like, is it like, are you still covered under your, drug program, or is there still things that you guys get as being ex-military members?
So I can speak to the medical release or 3B or 3 Bravo that I received. I don't know all the ins and outs of how it works if you just do 10 years or your regular release and then you get out. But there are absolutely programs that take care of and provide insurance coverage for international travel, prescriptions, things, sort of periphery medicine that you would kind of consider physiotherapy, massage therapy, things that a lot of guys have bad backs, bad knees, bad feet. Like these things are, and this is an area, again, I think I've chirped the military quite a bit in many of the pods that I've done, but I do want to recognize that they have done a pretty good job of enabling me personally the resources that I needed to get, again, the physio, the prescriptions, all those things are, most of that stuff is covered. The process for claiming them can be a little arduous and redundant. You know what I mean? Like dealing with Blue Cross, for instance, and having to get receipts covered for treatments or whatever can sometimes take 2 or 3 attempts just because it's an insurance company. And I think their agenda is to not pay you. I think that's every insurance company ever. But
Yep.
They do, to answer your question, they absolutely do provide that for you depending on your release structure or pathway that you got out. And if you medically release, like I kind of had to, that stuff is provided for you sort of in perpetuity. So I do have a reasonably good level of coverage for certain things. For the first time, actually, a few weeks ago, I billed a prescription because I did pick up a stomach bug and I had to get a specific kind of drug that wasn't covered. So that was the first time that I had submitted something and they said, oh, by the way, like this $25 medication is not covered, whatever, not a big deal. I'll eat that. But it does exist. It is there. They have done a reasonably good job of that, but to be able to navigate the release process to get a medical release like I did, it is not easy on its own. So like I represent kind of a very small number of people that sort of have been quote unquote effectively covered once I left, but I like I said, I still have to plug back into the civilian system and wait in line like everybody else when something sort of acute does come up and I need a specialist or whatever. So they do some things well, but there's definitely room for improvement.
Well, it's interesting because you talked about COVID for a minute, and because I had watched some of your past podcasts, I kind of delved into, what would be the coverage if I was permanently impacted by my COVID vaccine in Canada. So I was curious, and so I looked at it, and I dug, you dig into it, and there is a claim system under a company called Xera, and it basically is a Grant Thornton company, but it hasn't paid out a lot. So quite frankly, there's been claims. The government has allocated for COVID claimants who have side effects roughly, I think it's 75 million over 5 years they did, and now they've added 36 more million. So about 111 million they've put aside. Claims, from what we can tell, it's hard to figure out because this Xera company seems to be mostly AI driven. So, you don't ever get to speak to a person. So from what we can figure out, it basically reports about 11 million in claims paid out. So it's really not a lot. And then we said, okay, let's take a look at the US, because we're kind of curious to see kind of what the difference is between claimants. And the US has the same kind of issue with claimants on COVID. They have a big program set up, but they haven't paid out a lot. So they've had about 13,000 people apply. They've paid only 67 people, and each of those people, they've paid $4,000. So really peanuts. But the funny thing about in the US, they have another program, which I think you can also apply. They've paid $5.2 billion for vaccine side effects since 1985 to people. 5.2 billion, which is a crazy amount. So I think they commingle the two programs together. But yeah, it's interesting, how I was wondering, because I remember during COVID, all these new laws being passed that basically no one was liable for anything. Remember when all the governments were all passing all this legislation, making all the vaccine companies, not liable because they couldn't do the appropriate amount of testing, and all that was going on.
Well, it was so safe and effective that they didn't need to have any sort of contingency plan. You know what I mean? Which is the regurgitated garbage slogan that everybody heard. So the federal government did very sneakily roll out something. I think it's called the VISP, the vaccine injury.
Yeah,
I'm failing on all these acronyms. There's so many acronyms in my life. So they did roll something out that has already lapsed. So if you have not yet claimed your vaccine injury, I think it lapsed even as long as a year ago or more. If you haven't yet claimed or provided sort of documentation of what's happened to you based on your vaccine, you're not entitled to anything. So they rolled out this program with millions and millions of dollars earmarked to protect and help people that had issues. And there was like a handful of people in the entire country that received anything. And what they did receive, like you said, it was nothing and it was a joke. So this is still an ongoing effort for them to just damage control and control the narrative of this thing was absolutely necessary. Even before, like, I'm digressing here a little bit, but I think this matters. Even before the mandates came into the military, there was a 90+% uptake of the COVID vaccine for at least one of the doses. If not both. It was extraordinarily high. Like, you didn't need to convince people more or less to go and get this. Everybody was kind of on board for the most part. 9 in 10 people were on board to come in and take this and move forward. And then they still issued the mandates after that. And I think the lingering effect of that is contributing to this lack of trust, this attrition, these senior officers that they're not soldiers anymore. They haven't been soldiers in a long time. They're politicians, and they're just acting in the best interest of the people that they serve, which for the last decade plus has been a heavily corrupt Liberal government. So whether you're Wayne Eyre or the current CDS, Carignan, they don't really care about actually initiating policies that make sense or following up on the people that they did hurt. This is just a campaign of distract, deflect, delay, you know what I mean? Anything until it gets so long that it's memory hold from the people who just move on to the next manufactured crisis. And people, this bleeds into the last podcast that we did. Like, this is yet another problem that people are facing when they want to join. Like, they don't want to deal with this. They don't want to be forced into taking something that they're still pushing. DND is still pushing this vaccine on people before they deploy. It's no longer, quote unquote, mandatory, but I know personally people that are having career implications to this day because they're not taking boosters. They're not taking, they never took the original shot or 2 shots. And this is having lingering effects on them still. And all of these things bleed into one another of how many issues exist from the top down, where they could have, in my opinion, not easily, but simply come forward and said, what we did was a huge flinch overreaction, and now we're going to draw this back. But again, this would leave liability on them for doing that, and they will, in my opinion, they will never do this until a court forces their hand.
Wow. So they're still trying to get people, you know, and
oh yeah.
That's interesting because, you know, when you said that, it didn't. You guys must have been used to taking vaccines, right? Because as you're traveling abroad and you're doing, you know, you're going to different places, usually they do vaccinate people, you know, just in case they catch different things. So I could get that. Probably at the beginning, 1 shot everyone was good for. You know, we were the same way, you know, and not to go back and, you know, complain or cry about what went down, but you know, it was tough times for everyone. You know, we were all told in a very quick period to shut down, go home. You know, I basically laid off 660 people up in Ottawa, and then basically another 100 here, 760 people in 2 days, shut 2 businesses, you know, shut down 2 construction sites. Like, it was painful. You know, it was like 4 days. And, you know, I remember getting home and telling my wife, I said, I'm going to quit drinking now, because if I start drinking, I'm never going to stop. And that was kind of it. We kind of went sober for the whole COVID period because it was just overwhelming at the time. You didn't know what was going to happen. And, you know, you had to figure out a way to retool. And I think we did a good job personally doing that and from a business perspective. But for someone who was sent home from the military at the time, a little painful, because you guys are not meant to, number one, and I asked you before the show, like a lot of the guys were just told to kind of go home and, they downsized, they went to shifts and rotated. And, so you just go wait to be recalled. And that was kind of the way it went, wasn't it? They got
Yeah.
paid, but they kind of
Yeah.
sat and waited for the phone to ring again.
Yeah. And there was sort of, depending on what base you were in and what your role was, you would have sort of an identified time that you would need to be able to report if something did happen. Like, you're never kind of completely cut loose. But in the same vein as the medical stuff that we've been talking about, there's also a medical intelligence community that I was exposed to when I was an intelligence analyst. So in the height of all the hysteria of, you know what I mean, everyone's going to die, use hand sanitizer on your groceries, and you know what I mean, sleep and shower in your mask, like all the five masks, like all the stuff that sort of eventually became, if you had any common sense, you question this, and eventually became obvious bullshit. The medical intelligence community that I was working right alongside at top secret and above levels, they were pushing the narrative like you would not believe. There was zero questioning of everything that was coming out of the government. And we were told to trust the experts. The experts were the people that had all of those insanely idiotic forecasts and of how many people were going to die. And then you had, and they were coming from all over the world. So you had medical intelligence people in Canada briefing the chief of defense intelligence, who is everybody's boss under this umbrella organization. And they're telling him to tell the CDS that we need to lock down harder. We have no beds. You know what I mean? Everyone's getting, like, we're forecasting way more people to die. But as an intelligence analyst at the time, I wasn't seeing this. And anybody that, you know what I mean, went into a hospital was seeing empty hospitals. Like, were the ICUs full of, you know what I mean, 85-year-old people with emphysema that were having trouble breathing? Like, yeah, like ICUs are supposed to be full. And that's why they run at extraordinarily high operating costs with razor thin margins, so that they can, you know what I mean, you don't have 75 empty ICU beds running because it's too expensive to run them. ICUs in some places were full. But talking to civilian doctors, you know what I mean, much after the fact, I had one, I'm going off on a bit of a rant here. I'll bring this all together in a second. Speaking privately, candidly, with the top infectious disease doctor in Canada at the time, just a couple of years ago, he had obviously asked me not to repeat his or her name, and I won't, but this person received death threats for candidly saying on a public broadcast that we need to reduce the lockdown measures and return back to normal life because our reaction is overblown to what the threat is. This is not me giving my 2 cents as an intelligence analyst. This is the top infectious disease doctor in the country, working at the busiest hospital in the country, trying to tell Canadian media that what we're doing is an overreaction. And the woke sort of boomer mob that came after him of, oh my God, you're trying to kill grandma, and like kids need to stay out of school. We're threatening the life of this person. So this is the level of kind of hysteria and delusion that we reached, that I was seeing at the highest levels of the medical intelligence community reiterate to their bosses that we need to continue this momentum because everyone in this room is getting paid, and we will continue to get paid as long as this is locked down. And I'm in this room just questioning my own sanity, because we were quite literally instructed to dig into COVID, find out what's going on with it, use open source, use level 2, use level 3. Every resource, level 2 is secret, level 3 is top secret, access to reporting. And everything that I was able to dive into with access to some of the best and most current information at the time in the world was telling me that this was an overreaction. But the people in the medical community did not, for some reason, you know what I mean, want to acknowledge that. And it was just push this narrative up and we'll continue to get paid even though a fraction of us are required to work. It's just, this is all sort of holistically sort of coming together as this huge problem and distrust in the medical community. And now that's part of the D&D community. And I've been trying to shout this from the rooftops here for about 1.5 years now. And hopefully people are seeing this and it's resonating, that there was at no time danger to most people. They knew, and they ignored it.
Right. No, I get you. And Brian, here's, another angle that, when I was getting ready for the show, we were talking about, isn't there some protocol? So like the thing that kind of caught me by a little surprise in listening to a couple shows you had done previously, I'm thinking, okay, Brian's going to tell me that as soon as this happened, the military went into action and people were deployed into these strategic locations because there was emergency protocol they called for. Like, there has to be a pandemic protocol. But, and let me finish because then I'll come back to it for a minute. Because when we dug into it on a previous show, when we went and looked at the Arrive scam and everything going on, we really found out, quite frankly, there wasn't really an office that had to do with disasters in Canada. There was a couple people, so it was crazy underfunded. No one had really thought about it. So, like, what I expected to kind of hear was you guys would, so many of the military personnel would be deployed to the major cities. The hospitals would get extra security, and that everyone would be moving. That's what I thought. And then when I started listening to your podcast, I'm thinking, wow, the gentleman you did one podcast with, he is in the military. He's like, I work from home, and I don't even know why I'm getting a shot, but I never go out. And it was interesting. And I'm listening. I'm thinking, why isn't that, like, at that point you think people would have been moving, because we don't know what it is at that point. Like, we have no idea what's coming down, how bad it's going to be. So there had to be kind of an emergency plan for a playbook. There's got to be a playbook with certain things happen in the country. The reaction is A, B, C, and then then we have to adapt. I get it, but there should be some basics. Is there not?
This does exist. So for the last 25, 30 years, there has been contingency planning in the background from the D&D medical sort of contingency planning emergency response team. And these operational guidelines do absolutely exist. And then when everything happened, we sort of refused to follow it and just went along with whatever the scariest headline was. But the team at sort of Valor Legal, who is nothing short of brilliant in the level of due diligence that they've done through access to ATIPs and digging into, like, why did we do what we did? Didn't we have exactly what you just said? Didn't we have sort of planning in place that we could have just followed? And we absolutely did have it. And from my sort of investigation of it, it was somewhat reasonable in terms of how we were going to handle literally a flu pandemic that we've been planning for. And we didn't do almost any of it. So it was like a flip a coin, or, you know what I mean? What's the latest, if it bleeds, it leads headline that we're going to sort of follow to create more hysteria. And then you find out, if you do any kind of digging, that CJOC, so Canadian Joint Operations Command, which controls sort of the operational elements of all of the Canadian military outside of CANSOFCOM, had a program in place in the background to manipulate and psyop Canadians into believing the hysteria, because they wanted to create an obedient Canadian who would hear the headline, be afraid, and then do as they're told and not question any authority. So this was quite literally happening from inside the military in 2020 and 2021, where they were experimenting with messaging programs to, again, brainwash people into just following instructions blindly. And as a trained sort of soldier and officer, that goes against everything that you learn coming up through the system of your battle training. Like, yes, okay, you follow orders, but you're also supposed to make sure they're lawful so that you're not executing an unlawful order illegally, or do something that's, you know what I mean, just super poor planning that makes no sense. So you should be able to think critically, ask questions, and give feedback. It doesn't mean you don't eventually do the thing you're told to do, but maybe there's other ways to do it. Or maybe there's other influences that need to be considered from the outside about what's going to affect this operation. And they literally train some of the best soldiers in the world that I've worked with, not putting myself in that category, but other people that I've worked with, that are just brilliant people, even in the intelligence community, regardless of what I saw there, that threw all this out the window and just were like, yep, we're going to do, you know what I mean, plan A, because quite literally the cover of the Toronto Star says that we're forecasting 70 million COVID deaths. And that's what we're going to base our modeling projections on too. And it was almost like the worst. And I was the most junior intelligence analyst at the time. This is quite literally the worst reporting on reporting that exists. Like, they literally train you not to do this in intelligence. Don't just look at other people's reporting and then send that up, because you haven't really thought critically or given your own analysis of it. And that's exactly what happened. And it's quite scary. And went off on a bit of a diatribe there, but there, to answer your question, there absolutely is contingency planning. There are policies, operation planning already in place. And we did the exact opposite of that.
Yeah. No, it boggles your mind, because quite frankly, that's what the military, that's what they're supposed to do. Quite frankly, they're supposed to, execute a plan given a environment or a situation. So when I was listening to it, I was like, oh, wow, that's again, another thing that surprised me. The medical care surprised me. The healthcare surprised me. And when we dug into it, and I started listening to the stuff you had done previously, I'm like, wow, they all just sat around. They were doing what I was doing at the beginning. Now I kind of I got busy doing other things, quite frankly, because I was going nuts sitting at home. So I kind of retooled, my businesses and did everything like that, because I'm handy and I do construction. But quite frankly, I was able to keep my sanity throughout it, after figuring all that out. So, I just wanted to dig back into a couple of things, because, we talked about the doctors, and it's a very interesting. You brought up a point earlier, about, I think it was a relative of yours, a brother-in-law or whoever was a doctor, and we did this at the other show, but, a couple points. You can go in the military, you can get your education, and you can come out with no debt. He came out with 200,000. And, I'm tying these together from the beginning of this show. So you look at this, this crazy story that's come out this week, and everyone's kind of quiet about it in Ontario right now. They're like, the OHIP overbilling, because, doctors are kind of the sacred cow. You don't want to really say much, because, we all want to believe our doctors are doing the right thing.
And we can't afford to lose them because we have so few.
Yeah. Well, yeah, we have, and quite frankly, we're giving them a tough time. So they come out, they go to school, they come out with a couple $100,000 in debt. And, they don't go into the military. So, and I've talked about this on a previous show, on the Quebec show. The banks love doctors. The banks absolutely eat them up, quite frankly. And then when I mean the banks, I mean anyone who loans money. I don't want to pick on the banks, but anyone who loans money loves a doctor, because they look at them like an annuity. So I've had a couple friends that are doctors, and they joke with me about it. But quite frankly, they can get any loan they want, literally, for almost any amount. That's, if they take a $400,000 or $300,000 a year, and they take, the value of it over 20 years, they can basically graduate and move into a $2-3 million home. They can get a mortgage on it. They can join the golf club. They can, and then unfortunately, maybe they marry the wrong person and she's a spender, and all of a sudden, next thing he knows, he's got huge credit cards. Then the next thing you know, he's billing 24 hours a day, because he's trying to keep pace with that lifestyle that he's set up. So it's gone more and more. And a lot of them don't make it, quite frankly. A lot of them bankrupt out because of it, right? Because of the thinking behind it and the easy access to capital. So here's the thing, Brian. Here's a great thing that we can do. Let's try, as we try to increase our military, let's try to actually create a program for people who are going to commit to be military doctors, and go out and tell, which, if you look, have you ever seen a advertising program by the Canadian military that talks about the fact that you can graduate with no debt? Have you ever seen one that says be a doctor with the Canadian military? Because you can come out.
I don't think so. I just see advertisements for, you know what I mean, rainbow and blue hair military personnel that we like, whatever's the newest woke trend. But yeah, no, I haven't.
No, but we could be doing it, right? Again, that's like, like our last show we did. And I find this bizarre because we do these shows and we kind of come to the same, a little bit of the same point is you got a military, you got lots of spending going on. People, they want to increase the number of people. They don't have the infrastructure, but yet they don't want to go out and advertise for doctors to be trained and join the military, for medical personnel, for people to come learn a trade, for kids to graduate without debt. We'd rather figure out a way to get kids to go to school, come out with lots of debt, and then move back home and really ruin them, right? We're ruining a whole generation of people that basically were late. We think we're telling them to get educated, then they're coming out, and quite frankly, they don't have a functional trade. They can't make enough money to survive, and they don't have any pension ability. Like when you were mentioning about the doctors and pensions, these poor guys are billing 24 hours a day. They're probably stressed to the max, right? They're probably so levered out the wazoo that they can't make it. So they're trying to find a way, and the only way they can do it is keep billing OHIP till it explodes, right? So, and that's what they're doing, quite frankly. It's very obvious. I don't think, we're not saying anything that people don't know. So, but wouldn't it be great to do that and then start that? So when I go in, I have prioritized medical care by a dedicated service team, kind of like they did in Quebec. They created service teams. In Quebec was a brilliant idea. They they created medical service teams for people on a color-coded basis based on their illness. So if, like, for example, if your illness was critical, you went into a medical team of people who specialized in your illness. Like, that makes sense to me. And then you are given that treatment by that medical team, by that group, that service provider team. And it wasn't just one person. So you didn't have to wait 2 years to go into a hospital but they're not talking about any of these things. They're not having these conversations. But yet, we want to publish budgets and throw numbers out. It's a little frustrating at this point because there's got to be a group of strategic thinkers. There's really, you've alluded to it a couple of times in the military. There's got to be some really strategic thinkers in the military, quite frankly, some smart people who do a bunch of great stuff. Is there not an ability to create a plan or to figure out a way to allocate these monies to create these things?
There definitely is. Some of the people that I worked alongside in intelligence, in any field, but specifically intelligence, I couldn't believe I was in the same room as some of these people. Like, their ability to digest information, analyze the information, report on the information, give their predictions. You know what I mean? Intelligence gathering is basically finding a lot of information and then trying to predict what's going to happen based on the patterns that you're seeing. And the stuff that I was able to be exposed to and the people that I was able to be exposed to, I couldn't believe that I breathed the same air as some of these people, because I was, like I've joked before, like I'm licking the windows in this room compared to how smart and savvy some of these folks are. And it was a real gift to be around them and learn from them. And I'll never forget that. But there's the system itself is so bogged down with the rest of the team or the rest of the policies and procedures that are so slow and so useless that it brings everything to this. The chain is only as strong as its weakest link, kind of thing. And these people are just bound to, unfortunately, all this weakness and diffusion of responsibility that nothing really ends up ever happening in time. Everything's a day late and a dollar short.
I know.
But to answer your question, these people are there and they actually want to do good things. But I think it's a matter of time until they're not there anymore, because they're seeing opportunities elsewhere and they're just going to go where those are. Digress a little bit, like having these conversations privately with these physicians, civilians or military, the stuff they were saying to me, I couldn't believe it. Like, a military doctor that was a civilian in the military doing the job was listening and looking at my file and following up. And I met with this person relatively consistently, and she was listening to everything that I was kind of saying. And she was like, well, why don't you speak publicly about your own situation and others like you? You know, I mean, you have quite a lot to say, and you're articulating the way you say it. And I said, well, would you join me? You know what I mean? Would you sort of be the lever that I can lean on to justify what I'm saying? Because I don't have formal medical training. I just know what I've seen and what I've lived through. And she said, no way. Like, I cannot risk my pension for telling the truth, even though I agree with everything that you're saying. There's just no way that I can do that. I've been here 20 plus years. You know what I mean? I'm X number of years from not having to do this anymore. I've got kids and grandkids and all this stuff. So these people are there. They want to do the things that you're saying, but they're just handcuffed. And it was morale destroying. Like, I was already on my way out, and I was getting out, but it was just morale destroying. And the people that are there know this. The people that are still in the military know a lot of these things. And I guess that they get by just compartmentalizing and, you know, putting it behind them to just sort of be able to look forward and have any kind of pride or intrinsic motivation to continue doing their job. But I tend to give really long-winded answers, but the short answer is these people do exist. These policies do exist, but they're just not going to see the light of day with the current leadership that we have.
Yeah, it's interesting you're talking about. I was just reading an article, and it's coming up, and you know, we're going to do it on another show because it's becoming more. They're writing about it more and more. The fact that in March or whatever, how much money the military spends to basically just get rid of the budget they have. So, and it's actually, you know, they've been talking about it. I've seen it popping up again. You know, the government in general does that, right? By the end, coming to the fiscal end of the year, they start to just spend like a spending spree. And the last 60 days of the year is just like everything's being bought and going out the door like mad people. But again, I kind of come to it boggles my mind. And I know you're saying it's there. So, and I get it, like a strategic plan, an emergency plan, like how in a occupation that has to be based on discipline, right? To be a great military, you have to be disciplined, right? Because you have to have everyone moving. You have to be strategic. You know, they should be able to execute these programs. So if they think they need medical care, if they think they need housing, you know, the things we're talking about, they got to be thinking how to connect those dots. And if they're not, then they can't be serious about getting people, because if you can't get adequate health care and you can't get adequate housing and you can't get the people recruited, then, you know, you're just going to see that budget item sit there and then disappear. And quite frankly, right now in Canada, if we're not going to use that money, if we're going to allocate monies for things we're not going to use, that's the worst thing we could be doing, because the only way we get out of the conundrum we're in is that all programs we allocated money to in our budgets have to be functionally working and executed. Because, you know, we're getting to the point, you know, this week, I don't know if you're reading, but, you know, it's funny. People are surprised that Algoma Steel is laying off 1,000 people. I'm like, how could you be surprised? Like, how can you be surprised when you're seeing auto plants and you're seeing steel and lumber and all those things impacted? Well, they're telling us they're going to fund them. Yeah, you're going to fund them, but if they have no customers, you can fund them as much as you want. The guy can't use the money, but I'm not selling anything. You know, because he's got to, you know, you can fund them. They can use that money to reduce the sales price for a while, but when that money runs out, it goes back to a price that no one buys it at. So, you know, it just doesn't make sense. And, you know, I hope, you know, and I appreciate you taking the time for the show. You know, I hope as people listen to the show, I hope that they understand that it's not anymore about just getting a budget allocated to a line item. It's that they really need to focus on making these things happen. So thanks again, Brian. I appreciate you taking the time.
Thanks for having me. I'm super glad that there's informed folks like you know what I mean, raising these questions and having these conversations. It's really important. So I appreciate it a lot as well. Thank you.
Yeah, thank you. And for everyone, stay tuned. We're going to get a show going. Brian's got a couple more shows over the next week with us. One is coming up on procurement. So stay tuned and subscribe, and we look forward to seeing you soon.